everybody. Let me introduce myself. I am Dr. Vineeta Kaul, attached to Neotia Hospital at Rawdon Street, and today I'll tell you something about bleeding in early pregnancy. Sometimes when a woman misses the period, tests positive with the urine test, but still has some amount of bleeding present in the first 3 months, that is quite disturbing. The first thing that I want to emphasize, don't depend on Google or internet. Please go to your gynecologist urgent basis, and there they can find out whether it's a healthy pregnancy or there is some problem with the baby. Now sometimes it happens in early pregnancy with bleeding, you might be finding that pregnancy is not in the right position intrauterine. Instead of that, what we call an ectopic pregnancy, maybe a tubal pregnancy, and if delayed in diagnosis may lead to ruptured ectopic, which means a huge amount of blood loss inside the abdomen, and the patient may be coming to the hospital in a shock state. Urgent blood transfusion may be required. It's a life-threatening condition, better to be diagnosed early and treated early. So never delay any bleeding, pain in early pregnancy, and visit your doctor. Now suppose everything else is okay, the pregnancy is inside the uterus, but still some bleeding is happening. So we check with the transvaginal sonography to see whether the baby is growing or there is a problem. Sometimes baby has grown up to say 6 weeks, 7 weeks, but after that there is no heartbeat, which means early fetal demise. Again, this is a condition which requires urgent intervention. You cannot just keep a baby hoping week after week that the heartbeat will come back. It will not. So you must visit the doctor and follow her advice or his advice. Now sometimes the pregnancy is okay, but you're losing the baby. Some women tend to lose early pregnancy in the early days, say 6 weeks, 8 weeks, 10 weeks. There is a spontaneous loss, spontaneous abortion multiple times, 2 times, 3 times. Now this is a condition which is very serious. It may reflect on some autoimmune disorders or endocrine disorders for the lady, or sometimes some chromosomal problem in either of the couple. So both karyotype for both husband and wife becomes an essential test. So you must talk and report to the doctor and get all the tests done. Sometimes the baby in the early pregnancy, it is growing, but growing at a slow rate and requires progestational support. So these drugs, you cannot take them on your own. So you must go, get the test done and follow the advice. I hope I have clarified a few of the main causes for bleeding in early pregnancy. Thank you.